Welcome to Anatomy Dojo. Let's take a look at some directional terms. Begin by taking a look at the anatomical position. The anatomical position is our position of reference. When we look at the anatomical position is when our patient is facing forwards. This includes the palms facing forwards, where we see the volar aspect of the hand, and we refer to this as the palmar or volar aspect of the hand. When our patient faces backward, we see the posterior aspect of the patient. Also, the hands themselves, the posterior aspect of the hand is called the dorsal aspect of the hand. Now that we know the anatomical position of the body, and we know we need to be in an anatomical position to study the terminology, we look at the anatomical position. The first line we're going to discuss, or the first term we're going to discuss, is called the midline. The midline here is the middle of the body, refers to this black line that is in the middle of the body, not to be mistaken with the term medial. Medial means towards the midline. So, for example, the pinky or the fifth digit is medial to the thumb or the first digit on the left hand of this patient. So now let's look at the opposite of medial. The opposite of medial is going away from midline, and that term is lateral. Lateral meaning going away from midline. Now if we'll look all the way here and we migrate to our right, we will see terms cephalad and caudal. These terms are to be used to describe or put in reference the positions in the trunk of the body. Cephalad means towards the head, and caudal means closer to the tail or the tailbone. When we're referring to extremities, whether upper extremities or lower extremities, we need to use the terminology called proximal and distal. Proximal means closer to the trunk. Distal means further away from the trunk. So for example, if we look at the ankle is further away from the trunk than the knee. So the way we would express this is that the ankle is distal to the knee. However, the knee is closer to the trunk than the ankle. So the knee is proximal to the ankle. So it's a matter of reference and which joint you use first.